Well, the Independent Community Pharmacy Association has handed a petition to Health Minister Dr. Zweli Mkhize calling for the NHI to be implemented without further delay. This comes in the wake of the heated debate that has ensued since the NHI bill was introduced in Parliament a week ago. Yesterday, the DA reiterated its view that the National Health Insurance Bill is deeply problematic and that it should be rejected. DA leader Musi Mamani says that the party has raised its concerns with Parliament about the constitutionality of the bill. The bill is to be fully implemented in 2026 and aims to give all South Africans equal access to quality health care.
I want to say thank you for inviting me back to receive your petition, which expresses your commitment to the implementation of the National Health Insurance. I said yesterday that the community pharmacists are a natural ally of the National Health Insurance because we are all about reaching out to our community, to our patients, to promote primary health care, to promote wellness, to promote early screening, to promote early availability of medication to reduce the complications of diseases. You have just said it in a way, of course, that I've never imagined. This whole idea of PMAT, I've already whispered. That this week, I hope that you'll all be available. Let's get a conversation started even before we get the rest of the submissions in place, because we are standing at a threshold of a very fundamental change in our health system, and I think it's important for your contribution to come in early to say, how do we bridge the gap between the public and private sectors in such a way that the winner is our patients? And at the end of the day, there will be a few things which we might want to discuss and disagree about, but I think overall, the spirit of goodwill, spirit of cooperation, the spirit of wanting to work together and build a unique health system wherein we have access to health care for all South Africans, irrespective of whether they're employed or they're on medical aid. It's a very, very significant step in fighting inequality and addressing past disadvantages and creating a more equal society and creating a much healthier society. And therefore, I want to say to you, you need to be out there talking to your communities, talking to the public, just to indicate what you are willing to do for national health insurance to take root and to be successful.
All right, then, for more on this, we are now joined in the studio by Mogologolo Phasha, who is the director of NHI. Thank you, Mr. Phasha, for joining us here on SAT and SABC. Thank you for coming to our studios.
Thank you very much, bro. Well,
here's where I'd like to start with this. There's been a sort of haste from the Independent Community Pharmacy Association. They handed a petition, in fact, to Minister Mkhize to have the NHI implemented immediately. What do they get out of this? The Independent Community Pharmacy Association, first of all, let's start by who that is, who they represent, and why they want the NHI implemented right now.
All right. So it is important to understand that the Independent Community Pharmacy Association is an association of pharmacy owners who are independently owned in the market. So our members are over 1,200 members, which means the pharmacies across the country. Now, we represent 1,200 members. We represent over 20,000 pharmacists who are working in these pharmacies, and over 3,500 pharmacy support personnel. These are now pharmacy assistants and similar. Now, we are working inside the communities. As our name says, we are community pharmacists. Now, working in these communities, we therefore take interest in what happens in them. Right. We take interest in the health that exists or that is being provided to the communities. Now, the NHI, we believe that it is actually the most important part that is lacking in the health system today.
Can you tell me why?
Because we cannot, number one, I believe the country cannot afford not to have NHI. Because how many people are lacking the actual private healthcare service that exists around their communities? We have pharmacies that are within the communities, within the reach of many people, inside the townships, inside everywhere in the communities. But there is a lot of people who are not able to access this healthcare service, world class, I must add, that exists within them. But they are not able to access it because of cost and because they can't afford it. So we believe that these communities need to be afforded an opportunity to access pharmaceutical healthcare service that exists within them, primary healthcare service that exists around them. If you hear about the spread, just in the conference, we were actually told by one of our pharmacists from Lenasia. He says to us, in his neighborhood, there is about 16 pharmacies in about a square meter radius, a square mile radius. The same exists in other townships I can mention, Soshanguve, about 16 to 20 pharmacies. These are actually points for the same community to access. Right now, those communities are doing what? Looking for clinics around to go. How many clinics are there? Whereas there are this resource that exists in the community which they can tap into. Now, NHI will allow these communities to access this service that exists within them. And I'm just talking about pharmacies. It's not even limited to pharmacies.
Yeah.
GP practices.
I'm going to talk about the objections. As you know, there have been very many objections to the NHI. I'll get to that. But for now, as we were listening to Minister Mkhize, he raised a very important question himself that I'd like to explore further with you. He said, how do we bridge that gap between the public and the private sector? How will this be done? And I suppose this also still then leads to why we've had these sort of objections that we've had.
So you're saying, how would we bridge the gap between?
Yeah, how will we bridge the gap? I mean, the minister said it himself. This is all about bridging the gap between the public and the private sector. So how is that implementation? How will that be done?
The implementation is easy.
Yeah.
We are having, for example, I just mentioned these pharmacies which are having clinics within themselves inside their communities. Now, these are in private. So within them, we are having an Office of Healthcare Standards that will that will ensure that they are properly accredited through the Pharmacy Council, for example, where Pharmacy Council is actually the current accreditation body for pharmacies. So now, through that, you are instantly having a gap that is narrowed between the clinic that exists in that community and this pharmacy that exists in the same community. So a member of public can, instead of going from that clinic that he's been going to in his community, he can just go to this pharmacy. So immediately you have bridged the gap, because now you have given this member of the public a choice or an opportunity to not go and be exposed to those long queues that he has been having, and immediately go to these farmers that exist within the area. So you have bridged the gap already.
Are you of the view that these objections that have been raised, and we'll talk about the DA reiterating that the NHI is deeply problematic, are you of the view that these objections are sort of, is a classist issue?
It is classist, it's self-serving, it's people trying to ensure that status quo exists, who also feel that it's just narrow-minded policies that people are having, which are actually self-serving, nothing else. Because if you look at the current healthcare spend in this country, there's no way that anybody can justify that we are having over 230 million rands being spent on the number of people it's been spent on. And if DA is saying that that is justified, oh no, I contest that. How can that be justified? Because that money that is being spent in public health, even if you look at the health economy, who are benefiting out of this health economy? Because if you look at that money, that 230 I'm talking about, that is being spent in the health economy, it is actually being spent through few monopolies, if not oligopolies, that exist in the market. We need to ensure that that is broadened. And broadening that includes ensuring that those farmers and townships that I've talked about will have an opportunity to actually access that economy, which are currently being excluded by the people who are saying NHI is bad. How can it be bad when
We've
people
heard
are getting
the GA leader, Musime Abani, saying that the party will raise or has raised its concerns with Parliament about the constitutionality of the bill. In the eventuality that this ends up in the Constitutional Court, is that a fight you're willing to have and a fight that you think you will win indeed?
Oh no, it's not our fight.
Yeah.
In fact, the minister, if you realize, the minister came to address our conference twice in this weekend. He was with us on Saturday, and we petitioned him to come back on Sunday after our AGM, which is today, to come and receive that petition. Yeah. So now, when he opened his speech on Saturday, his first talk was that the constitutionality of the bill has been sent to state law advisors, and who have said to him that the bill will pass constitutional scrutiny. Yeah. And for us, that's not our fight in any event. That is for the department to deal with that. For us, we are talking about the communities we serve and how they will benefit, in actual fact, from having NHI being introduced in their communities, for them to have access. This is about access to healthcare. This actually talks to the national drug policy, which was mentioned like when Ngwasana Zuma was first becoming the Minister of Health. The national drug policy that came in 1994 under President Mandela, one of the first issues in that document is only about access to healthcare, access to pharmaceutical services. NHI will achieve it. And that's why on our statement today, one of the last things we are putting on that statement, we are saying, Minister, we need you to implement NHI because our patients cannot wait any longer. It's been how long since Ngwasana was a minister of health? It's been so long. And if the thought through was put in that long time ago, we cannot wait. Patients can wait. This country can wait. This country needs a universal health coverage. And there we are with an NHI. The issues about the bill, the relevant people must deal with that. We are on the provision of healthcare. We will deal with the provision of healthcare. We will deal with the provision of pharmaceutical services in the communities which we serve, which is where we exist. And that's all we're talking to.
All right. You know, just before we close, I know we've run out of time at this point, but I do remember the former health minister, Dr. Aaron Motsoaledi, talking about the fact that there will be some kind of cap in terms of what, private doctors can charge and so forth. I wonder at this stage, how are doctors feeling about NHI at this particular point? And is there a push to get them to support NHI? I can't imagine that, when you're capping what a person would have charged before, that they would then be supportive of where you're going.
Well, there's a fear of unknown because currently we are being kept. The doctors are being kept on what they can charge. We as pharmacists, we are being kept on what we can charge. Yeah. Firstly, by the department through the pricing committee. Medical aids today, they are dictating to health professionals what they can charge. So they want to be the only one dictating? No. You cannot do that.
All right, we'll leave it there. Thank you very much for talking to us and shedding some light for us there. That's the director of NHI, Mogologolo Phasha, speaking to us there. All right.